皆さんおはようございます。で
おはようござい
すね、
ます。
おはようございます。
ありがとうございます。
今回、実は先日の韓国のミーティングですごい、日本の人たちをですね、すごい歓待していただきまして、で、わざわざ日本人向けのセミナーまでやっていただいて、で、さらにその2回も食事会を開いていただいたんですけど、それ本当に韓国の皆さん、特にドクター・リーを中心になってですね、もういろんなことをしていただきまして、で、その時の勉強会で、いろいろな疑問が出まして、我々、で、その時に、その質問を送ったら、じゃあ、ちょっとウェブにはやってあげようということで、今回の状況になりました。で、もう皆さんもご存知だと思いますけど、ドクター・リーは世界的にも有名なですね、MD で DC なおかつあの AK 神経学のディプロメイト、神経学は多分フェローだと思うんですよね。そこまでも知識の豊富な方で、いろんな引き出しポケットを持っていらっしゃいまして、で、今回ドクター・リーがその中心になって、韓国に影響を広めまして、その結果、今回ちょっとミーティング参加して驚いたんですけど、例えば、信じられないですけど、将来のもう次期世界医学協会の会長とかですね、それこそソウル大学で得た名誉教授の司会とかがですね、AK を使って、マッスルテストを使って治療してるんですよね。もうそれにちょっと衝撃を受けたんですけど、そういう人たちが本当にプレゼンテーションしていただいて、で、これはもうやっぱりせっかく隣国にいる素晴らしい先生がいるのに学ばなきゃいけないということで、じゃあもうみんな参加できるようにしましょうということで今日になりました。I just introduced about the international meeting in Korea and also about you. Then could you start your presentation for us right now?
Okay. Yeah.
Okay.
Thank
ちょっ
you,
と一つ
Doctor.
だけ
はい。
連絡事項。Can I talk the 1 minute? あ、皆さん、オーディオはお話しされる方以外はちょっとオフにしていただいて、音声がちょっと今拾ってしまっている方もいるようなので、オーディオを必ず左下からオフにしていただけると助かります。で、途中退出も大丈夫なので、無理のない範囲でお願いいたします。じゃあ、ドクターリー、please, advance.
Okay. Thank you for preparing this webinar, Dr. Arai, Dr. Oba, Dr. Sato. Let's begin. Let's start. Okay. If you have any question, you can ask anytime during the presentation. It, it's 2008, I think 18 years ago. Uh, I went to a Chao ski resort with Dr. Oba. It's 18 years ago. It was nice. Uh, this is my topic is my lifelong experience of functional neurological approach. I, I I learned this kind of good approach by Dr. Carrick. Okay. I think Dr. Oba
これでいいの？
can explain it into Japanese.
はい。
Feedback, there are three mechanisms, feedback, feed forward, and different copy mechanism based on cerebellar learning by Dr. Carrick. Very difficult cases classified by these mechanisms.
今あれですか説明した方がいいですか Can I
あ、ね、
make a
はい。
Yeah,
explanation right now?
yeah, yeah,
あの、
yes,
ドクター、
please.
ドクター・キアリックが、彼学んだこととして、臨床でとても彼が、重要視しているっていうか、小脳の、学習機能なんですけど、それのメカニズムが3つありまして、フィードバックとか、フィードフォワード、それからエフェレントコピーっていうメカニズムが非常にベーシックになっているっていうお話になってますね。で、これから、小脳機能のディスファンクションを、お話ししていくっていう形で、フィードバックメカニズムからちょっと取り上げてみます。
Yeah,
どうぞ、
the
please.
case, yeah. case demonstrations. This is my case. Cerebellar dysfunction by repeated path mechanic manipulation by lay people without any appropriate education of manipulation or chiropractic. By I mean, biomechanical manipulation is important. This is Dr. Carrick described this mechanism as a feedback mechanism. And the next case, impending cerebellar infarction with hemiparesis, mainly on the left side, treated by manipulation, which is a feedback and feed-forward mechanism. Dr. Oba, please.
我々のカイロプラティックのバイオメカニカルな主義矯正ですね。これは、これにはね、フィードバックメカニズムが非常に重要な役割を果たしているということですね。関節のアジャスメント、そういったものが小脳にフィードバックされるわけですね。で、そういったケースをお話ししますということと、次のケースとして、大脳半球のインバランスから来る、大脳機能のディスファンクションですね。これをマニピュレーションで、フィードバックされていくときにはですね、さらに小脳から大脳へフィードフォワードメカニズムが働いていますという、そのケースをお話します。Please どうぞ。
Okay. Next case, dizziness and vertigo, spinning, and neurological claudication means difficult to walk and standing due to the pain of leg pain. That's neurogenic claudication for over 20 years. Basic underlying cause is a functional lesion of limbic system, emotional brain, explained by efferent copy mechanism. Please, Dr. Oba.
次に、20年間にわたって、めまいとか、歩行困難な、それから、ブレインフォグみたいな、脳がうまく機能してないようなケースでですね、それが大脳辺、感情面にも影響を起こしていたという形のケースのエフレントコピーのメカニズムからお話しします。Please.
Yeah, okay. The next case, dystonia, cervical dystonia, corrected by TMJ balancing and emotional component treatment, which is a feedback and efferent copy mechanism as well. Please, Dr. Oba.
はい、OK。次のケースはですね、TMJ、顎関節の機能障害からディストニアになって感情面まで影響を及ぼしたというケースをフィードバックとそれとエフレントコピーのメカニズムでお話しします。Please.
Okay. Acetoid movement disorder has been improved by bone marrow aspirate concentrate, mesenchymal stem cell injection. Acetoid movement disorder is described as what is the cause of this problem? It will be the cause of the problem would be subthalamic nucleus of Lewis of basal ganglia. Please, Dr. Oba.
次は、アセノイドムーブメントディソーダーっていう、大脳基底核のサブサラミックリジョンでの障害についてのケースなんですけど、それについてお話しします。Please.
Midline structure, midline functional lesion of cerebellum with spinal stenosis, treated by mesenchymal stem cell injection into epidural space. Then we can share that information through video. Dr. Oba, please. Okay, Dr. Carrick, cerebral learning. I think his PhD dissertation he described feedback, feed forward, efficient copy mechanism based on cerebellar function. Dr. Over, please. Okay. Let me explain about feedback, feed forward mechanism. This is a feedback. If there is a here periphery, let's say subluxation of lumbar spine, subluxation of cervical spine, or subluxation of SI joint, or leg length discrepancy, or any kind of things in periphery, decrease the activity, decrease the afferentation to the cerebellum. That means feedback mechanism problem. Dr. Oba, would you explain it briefly?
末梢の、身体の末梢の器官、感覚器官からの、情報はですね、小脳を介して大脳へこうフィードバックされるわけですね。ですから、関節に障害があったりすると、そういった問題が発生します。どうぞ、please.
And the feed forward mechanism is based on cerebellar, midbrain, and thalamus, and cortex. That's a kind of feed forward mechanism based on cerebellum.
小脳からさらに大脳へこの情報が伝えられていくときは、これはフィードフォワードメカニズムということになっていきます。Please.
Okay. Let me explain about efferent copy mechanism. Efferent copy mechanism is brain cerebral cortex here. Can you see this? Here, cerebral cortex to pons, pontomedullary reticular formation, pons to cerebellum. So we call cortico-ponto cerebellar pathway through middle cerebellar peduncle, cortico-pontocerebellar pathway. That's a efferent copy mechanism. Efferent copy mechanism. Yeah. Oh, okay. Go ahead, please, Dr. Oba.
小脳から大脳皮質へこの情報が伝えられて、その大脳皮質から今度、強を介して小脳へ、その経路でまた小脳へフィードバック、情報がそのエフェレントコピーという形でもたらされます。
Okay,
Please,
efferent
どうぞ。
copy, the important thing in regards to efferent copy mechanism is 20 copies. Okay, let me explain it. 20 information through corticopontocerebellum. Okay, one information corticospinal pathway to periphery. So 1 to 20 ratio. 1 to 1 going to the outside periphery. 20 going to the cerebellum. So efferent copy mechanism is very, very important clinically. Very 1 to 20 ratio. Would you please explain it, Dr. Oba?
末梢から来る情報が小脳を介して大脳皮質へ行きますが、その大脳皮質から強、皮質強小脳経路で小脳に戻ってくるときには、その20倍の情報となって、エフェレントコピーという形でもたらされます。ですから、比率として1対20という情報量の違いがあります。Please.
Okay. Yeah, if there is something wrong here, cerebral cortex or limbic system, there is a dysfunction or a problem of limbic system or cerebral cortex, it may affect the cerebellum, then we can have a kind of clinical symptoms by cerebellum. Would you explain
ですから、
it, Dr. Oba?
大脳皮質とかですね、そういった、あるいは大脳変異系に障害があると、その影響はですね、とても大きくて、 小脳という形に、小脳の症状として、現れるということになります。Please.
Okay. This is kind of a schematic mechanism of feedback. If there is subluxation, decreased it decreased afferentation to especially midline structure of cerebellum. So it's oh, I'm sorry. So decreased function of midline structure, especially vermal area or fastigial nucleus. Okay, please explain it.
関節に、サブラクセッションとかあったりすると、小脳の、正中部分、チューブとか、それがその脇の棒チューブに、その大きな影響があ及ぶわけですよね。Please.
Okay.
Okay.
Okay, I will show you the case. This history of path mechanic manipulation of cervical spine 50 times in 2 months. Early 40 woman, 40 years old. She had neck pain manipulated by lay people, not appropriately educated people in chiropractic or manipulation. Worse, the symptom, and she explained the bizarre symptoms such as dizziness, balance problem, or personality change, autonomic dysfunction, especially urination, etc.
40代初期の女性の方で、なんと2ヶ月間の間に50回ものその適切な頸椎のアジャスメントを受けた患者さんということで、様々な症状、ネックペインから始まって、ディズニスとかめまいとかですね、バランス障害、それから心理的なそのパーソナリティチェンジまで、自律神経の障害まで起きた症例です。Please.
Uh, in 1996, 30 years ago, I took the course of Dr. Perry chiropractic neurology, and I came back to my hometown, Busan, and I worked in small hospital as an orthopedic surgeon. And I think this was my first patient, a chiropractic patient. So she she had okay. Dr. Owa, please explain.
30年前、ドクター・ケアリックの機能神経学を知ってですね、初めての患者さんだっていうケースです。Okay, please.
Okay. Please look at this. In lumbar position, feet together, close eyes, sway. Left side or left side, either side, sway.
ロンベルクテストでこの、左右にこう体が揺れます。
That means, I think that means midline structure of cerebellar dysfunction.
このケースではやはり小脳の正中部での障害を示しています。Please.
Single leg standing, very difficult. Difficult, right?
片足立ちで非常に不安定です。
It's a tandem gait.
継ぎ足歩行です。
It is very difficult to balance in tandem gait.
継ぎ足歩行でかなり困難です。
Yeah, it is typical phenomena of midline structure of cerebellar dysfunction.
これは小脳の正中部での障害の典型的な例ですよね。
Okay. I try to restore chest biomechanic by rib manipulation.
胸郭部の機能をちょっと高めてます。
I thought the cerebellum is very sensitive to oxygenation. So if there is a chest biomechanic problem, I thought I should adjust first.
やっぱ胸郭っていうのは呼吸に関わってますけれども、小脳はそういった酸素の供給に非常に敏感に反応しますので、最初にこうした胸郭の矯正で、呼吸をスムーズにさせております。
Right after adjustment, Romberg test negative, so well balanced out right after rib manipulation. That's very interesting.
胸郭のマニピュレーションだけで、こうしてロンベルクテストが非常に安定性を増したということは興味深いですね。
Yeah, in 10 days later, tandem gait had been improved.
タンデム、継ぎ足方向も非常に良くなっています。
She said 3 days ago, she balanced had been improved.
3日後、とても症状が改善したと喜んでおります。
Okay, physical examination. Romberg test positive, feet together, closed eye, sway either side. Single leg standing, very unstable. Tandem gait positive. Finger to nose, she had dysmetria. Piano playing, decreased both side. Cervical spine, multiple area of subluxation. Just biomechanical problem. I adjust the rib manipulation first, and then a few days later, I try to restore the cervical spine subluxation correction. Yeah.
フィジカルエグザミネーションですけども、ロンベルクテストで、クローズドアイ、目を、併眼で足を揃えての、ってる状態で、体が左右に揺れたっていうことですね。それから、片足立ちでは、アンステーブル、不安定、それから、継ぎ足方向、タンデムゲイトが、陽性、それから、フィンガートゥーノーズ、指鼻テストですね。これはディスメトリア、測定障害ですよね。それからピアノプレイ、ピアノを弾くような指の動作で、なんていうか、稚拙っていうかですね。それから頸椎部、これはいくつかのレベルで、サブラクセーションが起きていたということ。それから、胸郭の、力学的な問題、呼吸機能的な問題があったということです。Please.
Okay. I did restoration of chest biomechanic, and I asked her respiration exercise, cervical subluxation correction, and exercise for balancing. Yeah, that's it. A very simple application.
どのようなそのアプリケーション、治療を行ったか、施術を行ったかっていうリストですね。胸郭、それから呼吸機能、呼吸、なんだ、呼吸を高めるエクササイズ、それから、頸部のサブラクセーションの矯正、それから鎖骨部のマニピュレーション、それから、バランシング、平衡機能を高めるエクササイズを行いました。Please.
Symptom have been improved in 10 days. Feedback mechanism will be improved by affrontation of spinocerebellum or posterior column to cerebellum.
症状はですね、10日で改善したということですね。このフィードバックメカニズムが、この小脳、脊椎から小脳への、アフレンテーション、側通を促したということです。Okay.
Okay. let me show you. That was a decreased function of neuron, especially on the cerebellum. And this case, I will demonstrate this case is close to threshold. Close to threshold, this transneural degeneration, especially on fastigial nucleus, midline structure of cerebellum.
この患者さんの場合は、小脳の、神経細胞がディジェネレーション、変性している疾患で、ということなんですね。はい、please.
Okay, one of Japanese doctor asked me through email, what is the treatment protocol for transneural degeneration? He described three ways of transneural degeneration treatment, but I didn't know the three kinds of approach. But my approach is very basic, very light, light or weak affrontation to this patient. Let's say not cervical manipulation or just a rib or a shoulder exercise with a hand bike or things like that. Let me show you the videos first.
Let me explain. TNJ トランスニューラルディジェネレーションの患者さんなんですけども、これは末梢からのフィードバックが効かないために、小脳で神経細胞が変性を起こすというケースですね。ですから、トランスニューラルジェネレーション、遠く離れるところで、変性を起こしたということなんですね。で、ある時、受講生から、こういったケースではどんな治療をしたらいいのですかという質問を受けたことがありますけども、私としては、強い刺激ではなくて、非常にソフトな刺激が大事だろうと思ってます。ということを話しておられます。Please.
Okay. Yeah, let me explain his history. He was a soldier in Vietnam War. There's a kind of a poison by American soldier. He got a lot of yellow. I don't know. I don't remember the name of drug. So exposure that kind of a drug, and then his symptom is sitting all day long is okay, and standing make him very serious symptoms, like you see the hyperextension of thoracolumbar area. Okay, increased spasm of lumbar back lumbar area. So it's very serious pain here, right here on back. So please look at the video. When he's standing, walking, the hyperextension of low back. Yeah,
ベトナム、
yeah. Okay, go ahead, please.
ベトナム戦争の時に従軍してた方で、アメリカのそのケミカルな攻撃によって毒性を帯びて、障害を起こした患者さんなんですけども、特徴としてハイパーエクステンションっていうこの、姿勢ですよね。ですから、長いこと経っていると非常に症状が出てくるということで、痛みが腰部にあたりに、非常に出ているという患者さんです。Please.
Yeah, okay. Yeah, very severe pain, hyperspasm here, and increased thoracolumbar hypolordosis in standing. Sitting, okay. Standing, walking, very serious problem. Okay. My treatment is very simple. I asked him, how to say, uh, hand bike, hand bike, hand bike. There's upper body ergonomics, in my clinic, 3 times a day, or 30 or to 1 hour hand bike. And I tried to support his low back, corset, like I don't know the name in English, corset. There's 2 approaches. I didn't adjust the cervical spine or any kind of strong stimulations. Dr. Koga, please.
この患者さんの場合、何をしたかというと、非常に、シンプルで、あの運動器具を使って、あの、手あの手で示してましたけど、何かこう、運動させていることとか、あと、コルセットを使用して、刺激をもう極力少なく状態で、施術したケースです。ですから、アジャストメントとかそういうことはしておりませんっていうことですね。Please.
Yeah, okay. His main problem is close to threshold of neuron, vestigial nucleus, and cerebellum. So if I adjust the cervical spine or any other strong stimulation, his symptom will get worse. And so
こ
I
の
tried
この
to,
患者さ
yeah,
ん、
yeah, okay, go ahead.
この患者さんのケースはですね、トランスニューラルジェネレーションということで、小脳に変性が起きていますので、それが、室長核、小脳の室長核のところで、起きていましたの、起きているということなんですね。Please.
Okay, so I just very slow exercise without exceeding metabolic rate, manipulation without exceeding metabolic rate. So in about several months later, his symptom getting better. Yeah, he tried to treat this kind of problem all area of the Korea for several years, but now his symptom has been improved several months.
この小脳のトランスニューラルジェネレーション、ディジェネレーションを受けますと、クロストファシスレスホルドといって、非常に域地に接近しているわけですよね。しかし、すごく神経が過敏に反応してしまうという状況なんですので、強い刺激は、避けているわけです。これが彼の場合は何年間もこういう状態だったんですけども、こういった、アプリケーションで、簡単なソフトなアプリケーションで、改善が見られたということです。Please.
Yeah, he became a marathoner, 10 kilometer or 20 kilometers several times a week. Yeah, he referred a lot of patients to me after this wonderful treatment.
こうした施術でですね、もうかなり改善して、自分の声もまた、来ることはないっていうこと、なかったってことですね。はい。Please.
I only asked him a upper body ergometer, hand bike, and the corset, and gentle exercise. That's it. That was my approach.
ですから、ハンドバイクとコルセットと、そういった、施術だけで、これだけ良くなったということです。
This is a kind of beauty of chiropractic neurology by Dr. Carey.
これがドクター・ケアリ君の非常に典型的な方法だということです。
I think with these 2 cases, one is decreased function of neuron. This one is close to threshold, transneural degeneration, close to threshold in chemical potential. I I show you two cases. One is decreased function. The other one is close to threshold, transneural degeneration.
まあ、
One is
これか
decreased
ら
function, one is, yeah, okay, go ahead, please.
神経細胞がクロスにストレスの方で非常に敏感になるようなケースを、まあ、この一つの例として、次にケミカルな要素としての状況のケースをこれからお話しします。Please.
Yeah, this feedback, feed forward, and event copy mechanism. Okay, I will show you the next case. Left-sided hemiparesis, MRI, CT scan, no lesion in the brain. One of my colleagues in General Hospital in university referred to me. And okay, please watch our finger to nose, piano playing, finger agnosia, or decreased sensation on left, Romberg test tandem gait.
この患者さんは左側の、不完全麻痺ということですね。それからMRIT とか MRI とか CT の画像検査では脳に障害が見られないということで、病院から紹介されてきた患者さんということらしいです。で、このケースのフィジカルエグザミネーションをそれぞれよく見てくださいということです。Please.
Okay. Please look at the video. You see some kind of a sway. And in Romberg position, close eyes, eye challenge. This kind of challenge. There is a sway multiple ways, multiple directions. Yeah. Yeah. I examine finger to nose. Please watch out. She doesn't know where is her nose, right? The left finger. Right side is okay. Yeah, left side. Okay. Difficult to find out, to touch, difficult to touch their nose. Right side is okay. Left side is a serious problem. That means right side of the brain dysfunction probably. Okay, examination of sensation. Touch bilaterally, she can she feel the sensation on the right side, but not on the left side. That means the right side of parietal and the dizziness and the right side of headache, no eye pain. Oh, sorry.
右側の脳で何か障害があるような検査内容を示しております。
Okay. Tandem gait. Yeah, difficult in tandem gait means it's a kind of corticopontocerebellar pathway, different copy mechanism. Difficult in
こ
tandem
の
gait.
継足歩行の場合は、エフレントコピーとしての皮質強小脳経路に問題があることを示すことが多いようです。
My application, afferentation from left side without exceeding metabolic rate. It's the same case of a cerebellum close to threshold transneural degeneration, right? effluentation from left side without exceeding metabolic rate. It's a kind of mechanism, feedback and forward mechanism, and respiration exercise, restoration of chest biomechanics.
左側からですね、体の左側から、神経細胞の代謝能力をですね、超えることなく、ソフトな刺激を与えることになるんですけども、この場合は、フィードバックと、それからさらに小脳から大脳皮質へのフィードフォワードという機構を、作用し、ここが、機構に作用するわけですね。呼吸のエクササイズ、呼吸運動とか、それから、胸郭のバイオメカニカルな調整も必要となります。はい、どうぞ。
Okay. The same day after application, I adjust the finger, shoulder, foot, rib, respiration exercise, and then left-sided cervical manipulation. That's my application, detail.
左側にですね、指とか肩とか、そういったところからの刺激を、与えたっていうことですね。その結果、非常に改善したっていう。
Finger to nose. You see the piano playing. Piano playing is better. Finger to nose. Oh, it's better, right? The same day.
同じ日に施術した後の結果ということらしいです。
Yeah, it's a feed-forward mechanism and different copy, frontal lobe or any area of the cortex, cerebral cortex, or limbic system, emotional brain, going down to pontomedullary reticular formation to cerebellum. That's a different copy mechanism again. The case, vertigo for 20 years, cerebellar dysfunction with nystagmus, the spinning. He always a symptom like sitting in the boat with a dizziness, sometimes a vertigo. He cannot stand for 5 minutes, cannot walk for 100 meters since November 1997. Dr. O, explain it,
このケースはですね、眼視を伴った小脳機能のを患っているめまいの患者さん、20年間患っている患者さんのケースです。でちょうどボートに乗っているような感じで、座っているとボートに乗っているような、ふらつき感というとか、めまい感があって、5分間も立っていられず、しかも100メーターも歩けないというような状態が続いていたというケースです。
Yeah.
Okay.
Yeah, at that time, he was a military officer. He should take care of a bomb unexploded due to the technical error. He felt too much anxiety and exhaustion after that event. The next day, he has felt the vertigo. Initially, there was nausea, vomiting, fever, but in the medical hospital, doctors in neurologic or ENT departments could not find the reason of his problem.
この方は兵士がミリタリー軍のオフィサーだったんですけども、彼はたまたま事故で爆弾の爆発を受けまして、その後すごい不安感とか、その疲労感がひどくて、あとめまいが発症したっていうことなんですね。それから吐き気とか、実際吐いたりとか、それから熱が38度から39度の熱が出たりはしてたんですけども、病院では特に 問題を見つけることができなかったっていうケースです。Please.
Okay. So let me see the case. Fit together, close eyes, Romberg test. Right? Severe instability, right? You see instability. Let's look at the tandem gait. Backward is more difficult. Tandem gait, instability, right? Oh. And yeah, piano playing, pronation, supination, this diadochokinesia, very deep slowness. Okay. It's very you can see what's happening. That means the cerebellar dysfunction, and you can see the eye movement. Yeah, movement of eye, right? Then what will be his symptom? Nystagmus, that means dizziness and vertigo. A fast movement, vertigo. Slow movement, dizziness. Very apparent. Okay, let me explain his problem schematically. Yeah, if he has a lesion here, cerebellum, cerebellar lesion, especially floccular nodular lobe, fibers going to the area acoustica, vestibular nucleus. Okay, there are 4 vestibular nucleuses: superior, inferior, medial, lateral. Okay, these fibers ascending medial longitudinal fasciculus, ascending medial longitudinal fasciculus going to the extraocular muscle nuclei, and going down here, descending medial longitudinal fasciculus or lateral vestibulospinal tract going to the intrinsic muscle of spine. So if there is a dysfunction here, there's eye movement, right? He feels some kind of spinning or dizziness going down this area. He has low back pain or spinal lesion, or spine symptoms. Over, please.
前提小脳と言われる変容小節部とか、そういう心からの障害が、まあ、前提神経核4つあるわけですけども、そこから内側重側っていうことを通して、眼球運動の眼球運動の神経核へ、つながっていくわけですので、そういったところで眼球運動の眼神ということが現れます。そして、外側の神経核、前提神経核からは、その各脊椎レベルに、その支配が及ぶわけですね。前提脊髄路という形で、伝わっていくわけですので、脊椎に、障害を及ぼす、インバランスな状況を引き起こすということになってですね、腰痛とか痛みという形に現れてきます。Please.
Yeah, in my examination, this eye movement or dizziness or vertigo the symptom will be the same as the spine symptoms, low back pain or neurogenic claudication. Okay. If these two parts is the same, the common origin, one origin. So you can treat only vertigo dizziness, or you can only treat the spinal stenosis. It doesn't work. He did he went to the orthopedics for low back pain or neurogenic claudication. He went to the vertigo dizziness in ENT or neurology, but the outcome of treatment will have been failed. So then we're gonna treat basic underlying cause, Probably in this case, right now, his main problem is the cerebellum. Dr. Oba, please.
緩急運動とその脊椎っていうのは、このように非常につながっています。つながっているわけですよね。まあ、非常にですから、脊椎だけの問題っていうふうに、とか、緩急運動っていうのは別々に扱うってことはあまりないわけですよね。まあ、とにかく、一体みたいな感じになっております。
Okay, I treated him cranial fault and efferentation of to the cerebellum and the cerebral cortex. There is video. We don't have much time, so I skip this one. Okay, this is I try to correct cranial fault and efferentation to the brain.
ちょっと時間がないので、ビデオはお見せできないんですけども、まあ、アプリケーションとしては、AK を使ったクラニアルの、調整と、それからアフェレンテーションという、神経学的なアプリケーションを行っています。Please.
Let me show you the shortcut of brain, check brain, cerebral cortex and cerebellum, like this. That means the left side of decreased hemisphere. Left side of decreased hemisphere.
左側の、ディークリストヘミスフィリスティですね。
That's a cerebellum. It 1, 2, 3, 4. Four. I learned this kind of methodology from Dr. Frank, TBM. I think Dr. Arai will explain it in detail in Japanese. But this one, and I developed the decreased hemisphericity to check decreased hemisphericity in shortcut, not Dr. Carey, but I think it works sometimes. Yeah.
ショートカットになるんですけれども、
Okay.
この形、誰か、ちょっとお名前忘れましたけど、ちょっと教えてもらったショートカットの方法ですね。
I think here in doctors, you can use this kind of methodology in your clinic. I think it will save your time for examining your patient. Okay. And the eye efferent. And after this cranial and decreased hemisphericity on the left side, treatment before is sway, right? And after, right after treatment, the same day. Oh, it's better, right? I thought that it worked, but oh. You see stability, right? And tendon gait. And lumbar test, tendon gait, failed. Oh, sorry. tandem gait backward. Oh, they're very slow. I asked him, walk slow. That's better. And let's check eye. But you see, still movement. It's better, but still eye movement. You see movement. That's nystagmus. Still nystagmus busy with the claudication. So that's not the appropriate treatment. What is the main cause of his problem? I checked the neuro-emotional point right here. Neuro-emotional point, tuberosity, frontal tuberosity, bilateral touch, we call TL, therapeutic localization, TL, touch here, then strong muscle gets weak. That means emotional problem. He has emotional problem. What is the main cause of the brain dysfunction with nystagmus of this patient? Then I thought emotional component. Unbearable sadness when his father had passed away in his 4-year-old, especially to watch his father to put into the ground. This boy, 4-year-old boy, thought that the people buried him alive. Okay, let me explain about the funeral custom in Korea. Here in southeast part of Korea, in my home country, okay, we usually, if somebody had passed away, and we put the dead people in the coffin, then put it in the ground. That's the normal funeral custom, right? But in our country, in the tomb, then take off the coffin, and then put the naked person put into the ground into the coffin. So, and buried him. So in that funeral service, the 4-year-old boy thought that the people buried his father alive. Okay, that's unbearable sadness. Okay. Would you explain it in Japanese, Dr. Oba, please?
この患者さんの場合、眼神がまだ残ってたりして、十分じゃなかったということで、彼の場合なんか感情的なコンポーネント、感情的な面で何かあるんじゃないかということで、セラピーローカライゼーションを前頭部でタッチして調べたということなんですね。彼の場合は、少年の頃の、記憶が埋もれてたようで、父親が生き埋めに生きたまま埋葬されるような状況を彼が心の中で持ってたっていうことが、心の隅にあったようなんですね。それが、感情面での問題を引き起こしているんじゃないかということを、永久的なアプローチで、探っていったということなんです。ちょっと韓国の、同窓の様子をとお話になったんですけども、ちょっと頭に今消えちゃいましたんで、省略します。Please.
Yeah, too much anxiety in his experience of military officer was not the core event of negative emotion, but a trigger of his dysfunction. And the correction of cranial, yeah, go ahead, please.
彼の場合は、軍隊での、あれは、直接的な問題ではなくて、心の中にあった問題がトリガーになったと思われます。Please.
The correction of cranial fault and the balancing the brain could not improve nystagmus and the claudication.
当該の調整とか、その脳機能のバランス的な形で、ニスタグマス、眼神とか、それから歩行困難っていうものを完全に解決できなかったということなんですね。
Okay. Yeah. Okay. In next time, we will discuss about Dr. Sato's case, and I recommend Dr. Sato. Probably there will be some kind of a core event. When I check his problem, one core event, or there is some other core event will come out. I think if this kind of explanation, Dr. Sato can check his core event, one or two case event, or okay, then will help him out a lot, I think. Unresolved significant core event of negative emotion or belief or decision may affect neurologic, visceral, and structural problems in the body. That over, please.
心の中心部分で、その解決されてない感情的なこととか、それから誤った確信となっているようなそのものですね。そういったものが神経学的にも内臓学的にも、また骨格的にも問題を引き起こすということです。Please.
Okay, yeah. How to find the core event of emotional stress? How to find the basic underlying cause of event of emotional stress? And yeah, first, TR on neuroemotional point and tuberosity of frontal bone here. Then strong muscle gets weak. That means emotional. The patient has emotional stress. And I will ask touch right here. It's just below the xiphoid process. It's an alarming point of heart meridian in acupuncture. So here, touch here, and ask patient to recall the stressful event. And the stressful event is framed. Stressful event is framed in four part. One is time, 4-year-old, space, funeral service. Person is father, event, put into the ground and his father alive. That was the frame. Okay. A stressful event is framed by four part. Okay. That's very important. And then test indicator muscle. That indicator muscle gets weak. That's a specific part of a stressful event. Dr. Ober, please.
心のストレスな出来事っていうのは4つの、フレームからなってるわけです。時間とか空間、それからその人物、そして起きたことっていうことが、枠組みになってるっていうことですよね。枠組みの中にあるっていうことですね。Please.
Okay, if the patient has a heart problem, then if we touch here, without any recall, the stressful event gets weak. In that patient, we can use the stomach meridian or other meridian as well. We use other meridian in the midline structure. Can you explain it, Dr. Oga, please? Yeah,
体の成長部分で、触れながら、マッスルテストを行って、強かった筋肉が弱くなったりとか、そういった反応で、問題の場所を、どの内臓にも影響が与えているかということをセラピーローカライゼーション的に、探っています。Please.
right. The core event, let me explain about the core event of emotional stress. The young ager, okay, below 5 or 3, 5, 6, 7, that is very important. In fact, that means family dynamic is very important in emotional stress. So I usually ask patients, I think I sent the questionnaire, stress questionnaire to Dr. Arai. Probably you have this, my stress questionnaire. That's one sentence. Okay, time, location, person, and event, 4 things, and also your emotional problems. Emotional, okay, let's say hate or anger, anxiety, etc. Okay, then we can check muscle test without any detailed, long personal history. Just the one sentence muscle test, then we can find out the core event of emotional stress, or two, one or two, usually one or two. In his case, there's two. One is a 4-year-old child. The other one is working as a military officer. Okay. So deeply seated hidden core event will cause another emotional problem. This may cause various problems. Okay, various emotional problems. And ANS dysfunction, neurological problem, and physical phenomena to evoke various symptoms. Okay, Dr. Oga, can you explain it?
ちょっと私も、頭がはっきりしてこなくなったんですけども、この5歳から6歳、7歳ですか、その頃に、家族の問題とかでストレスを受けてる、ことがあるんだろうということですね。それから、その後また次に、神経学的な問題で、症状を発症するような出来事がてくるというような話だったと思うんですけども、ちょっと間違ってたら、どなたか訂正お願いします。これが感情ストレスのコアになっている出来事の流れだったということですね。Please.
Yeah, in my experience, the family dynamic is important. Okay, parents-child relationship, and between two-parent relationship, wife and father, and the child watching out, fighting together, fighting mother and father. That's a very serious emotional stress in childhood.
小さい時の夫婦間の不和とか、そういった出来事っていうのは、子供の心にすごく影響、ストレスなんて根付いていくんじゃないかっていうことですよね。Please.
And my patient, 60-year-old patients, the emotional stress in his childhood, but his father and mother passed away, but still the core event of emotional stress was when he was a child and 10-year-old or something. Yeah, this.
60歳の私の患者さんでも、その問題が子供のところの両親が亡くなられたこととか、そういったことのイベントがありました。Please.
Yeah, a timeline therapy by Dr. Ted James Ted James is an NLP neuro-linguistic program practitioner. He developed timeline therapy, TED, I don't know, James, James. If you look at the timeline therapy by Ted James, you can read. It is a very simple approach to understand. It is very easy. Timeline therapy, I will explain. Dissociation of the space and the dissociation of the time. Okay, which was framed time, space, person, event, right? So this treatment, the goal of this treatment is dissociation of time, dissociation of space, person, or something. Then the emotional stress gone. That's a simple way. Dr. Oba, can you explain it?
タイムラインセラピーっていう、ヘッド・ジェームスっていう方が、の考案で、その概念ですけども、えーコアになっている幼少期の問題が、時間的にも、それから空間的にも乖離を起こしている状況があって、それが現在のそういう神経学的な問題として、現れてくるということを、仮説的に述べております。Please.
Okay, you can apply this. If you find out the core event, you can apply with this timeline therapy or TFT or EFT, any kind of methodology you can use. The important thing is to find out the core event. And Dr. Over, please.
Could you say once more? EFT, please, sorry, I missed your
Yeah.
words.
Okay. What kind of okay? The important thing is to find out the core event, regardless of application. You can apply these patients with timeline therapy or TFT or EFT, various approaches.
どのような心理的なアプリケーションを取るにせよですね、コアとなっているその問題を見出すということが大事だということをお話しされていました。EFT とか TFT とかおっしゃいましたけども、そういったどのようなアプリケーションを取るにせよ、そういったところがまずタイムラインセラピーとしてコアのイベントを見出すということが大事だということです。Please.
Okay. Yeah, after emotional treatment, you see the eye improved, completely improved, and also neurogenic claudication has been improved. Okay, right after emotional treatment. Okay, let me tell you, cervical dystonia. Yeah, you see the movement, the spontaneous movement. Spontaneous. This is a kind of a typical cervical dystonia. Yeah. Okay. My personal approach to movement disorder, neurological approach, emotional treatment, and TMJ balancing. Okay. Okay. Let me show you some kind of emotional approach. Part of my emotional approach. Spirit possession. She has a spirit possession syndrome. Like I did this kind of treatment under hypnosis. But it described by Dr. William Baldwin's method. Please watch it. Under hypnosis, she was going like this. Yeah. see the kind of various acting out spontaneous movement or something like that. It's a kind of emotional treatment if somebody has a spirit possession syndrome. And malocclusion with the TMJ dysfunction. Please look at this midline structure here off the midline. In TMJ practitioner, most of TMJ practitioner state that midline structure of the midline structure may affect neurological dysfunction. Okay. So I restored TMJ device and restored the midline misalignment. And the mechanism is TMJ muscle or TMJ muscle or joint or cranial-mandibular misalignment may affect midbrain, the midbrain nucleus, proprioceptive nucleus of midbrain, mesencephalon. Dr. Oba, can you explain this?
この患者さんは、なんていう、心霊的な現象みたいな、激しくうずい的な動きを見せる患者さんで、スピリットシンドロームっておっしゃってました。何か、ちょっと、なんて訳していいのか、精神的な、あるいはもっと深いところでの、問題を抱えている患者さんのケースなんですけども、この患者さんの場合、とても、施術の仕方としては、アプリケーションとしては、TMJ の問題をアプローチしていくってことが大事で、科学の、不整合といいますか、噛み合わせの問題とか、不関節の、科学の、バランスとか、そういったところで、アプローチしていくのが彼の、アプリケーションとしてとても重要なことらしいんですね。それが、中脳レベルに、対応しているっていう話なんですね。Please.
Okay. Before treatment, improve the dystonia movement. Other symptoms have been improved. This one is previous one. After application, her symptom had been improved. Dystonia movement as well as headache, neck pain, and neuropathy. Okay, Dr. Oba, please.
この最初、頸部のディストニアですね、激しく、ディスキネジアと言ってもいいのか、ディストニアの患者さんが激しく首を動かしてましたけども、これは噛み合わせの位置を正中に合わせた、科学の位置を合わせた状況で、非常に安定した状況を見せているということですよね。すごいですね。Please.
Okay, let me demonstrate the athoid movement disorder treated by BMEC, bone marrow aspirate concentric mesenchymal stem cell. BMEC from ileum. What is the mechanism of MSC, mesenchymal stem cell in the brain? The increased progenitor cell of neuron, more synaptogenesis, and more angiogenesis. Okay, let me show you the athoid movement. Please watch the video. This is a typical athoid movement, dancing-like movement. Here, dancing-like movement. It is a very tough case. This is my first time to improve athoid movement. The subthalamic nucleus Lewis lesion, basal ganglia, subthalamic nucleus Lewis. It is my first time to improve the case. I don't guarantee when I see the patient Parkinsonian disease, and this is especially athetoid movement. If patients or patient ask me, can you improve my symptoms? I think I will answer, no guarantee. I try, no guarantee. So after, I think about 5 months later, 2 times application, I better. You see the facial expression of hand movement or walking has been improved. Better, right? I think stem cell application is far advanced in Japan because of not strict regulation, but in Korea and United States, very strict regulation. It is hard to get in these areas, especially culture, this culture meniscal stem cell, mesenchymal stem cell. So, but I think it has been improved after stem cell injection intravenously. In my case, 2 times.
先ほどの患者さんの場合は、ドクター・リーが初めてそのアテノイドの患者さんを治療できた最初のケースだとおっしゃってまして、非常に劇的に改善したわけなんですけども、MSC、骨髄のメゼンカイマル、ちょっと訳ができないんですけど、その細胞に対しての静脈注射の、によるアプローチだったらしいんですね。ちょっと詳しいことちょっとわかりませんので、そういった内容です。Please.
Yeah, severe neurogenic claudication due to spinal stenosis with decreased functional cerebral midline structure treated by mesenchymal stem cell and the manipulation. Okay, let me show you some kind of slide. A site of aspiration of I will mark CM fluoroscope here. Posterior superior iliac spine area. This is the thickest area of ilium, the cancellous bone, and marking like this, and needling here, and aspirate bone marrow here, about 240 cc here. The bone marrow aspiration, and in the laboratory in my office, in my clinic, they make the concentration, the bone marrow aspiration concentrate. Then we'll inject. In this case, in these patients, I will try to epidural space injection by coda, by ultrasound guided injection, 8 to 10 cc. Like this. It's videos. Okay. Here, needling. This is a caudal entrance here. Sacral conum, right, entrance here. Needling epidural space. It's a longitudinal section. It's a coronal section, needling. And you see the video. You see wide base gate, right? It's a typical cerebellar dysfunction. Yeah, you see the wide base gate. That's cerebellum. And yeah, single extending. very difficult. Yeah, mid 70, it's difficult, but yeah, but it's a very trouble here. Difficult, totally unable to lift his leg. That's a typical midline cerebral dysfunction. And about 2 months, 2 months later, I think you see this very improved the wide base gait. This one. And single leg standing, better, but a little bit instability, right? So, and six, I don't know, let's see, either about 10 months later, lifting, oh, it's better. Mid 70, it's normal. Mid 70, most of people have some kind of instability. The wide base, walking has been better. Yeah. It's kind of another way of the feedback mechanism approach. Thank you very much for just this is for neurological approach. Any questions? Without any questions, okay. Without any questions, please, Dr. Arai. Thank you for translation, Dr. Over. And Dr. Arai,
Okay.
could you, Dr. Arai, could you explain next session or brief introduction, explanation to the audience?
OK。次はですね、韓国の病院でですね、この間の韓国のセミナーの時に、やっていただいたデモというか、セミナーの内容をちょっと細かくブレイクダウンして説明していただきます。で、こちらはちょっとかなり AK のスタッフを使いますので、先にちょっとドクター・リーがいろいろデモンストレーションを説明してくれる前に、ちょっと基本的なその内容をちょっとごオーバーしますんで、can I share, Dr. Lee, could you stop sharing?
Can I put this
はい。
one? You can do this.
んあ、just close. I think, stop sharing. Okay. Stop sharing. で、先にちょっとですね、ドクター・リーがやってることが結構引き出しが多くてですね、何やってるか途中で分かんなくなると思うので、先にちょっとパッと説明しておきますね。まあ、予備知識としてですね、まず脈振点は皆さんご存知だと思うんですけど、脈振点使ったり、ゲート歩行テストですね、ゲートテストっていうのを使います。で、これも皆さんご存知だと思うんですけど、いわゆる心筋とか屈筋とかですね、でまあ、 横のラテラル、速報とかですね、そういうのを使うんですけど、ドクター・リーはパロアルトっていう言葉を使うんですけど、これはカリフォルニアにパロアルトっていう場所がありまして、で、そこでですね、そこの地名の頭文字が覚えやすいっていうんで、皆さんアメリカ人とかその他の国の人たちはみんなこのパロアルトっていうのを使って覚えてるんですね。で、P っていうのがポステリアゲート、心筋ですね。ポステリアゲート。で、これは脾臓と関係あるメリディアン。それで A、パロアルトの A ですね。A がですね、アンテリア、クッキンですね。クッキンと関係あると。で、次がですね、ラテラルゲート、ストマック、胃と関係あるゲートですね、速攻の検査。で、オブリークと斜めですね。斜めが、O の斜めがですね、ガルバッターだから、胆のうですね。胆のうと関係あると。それで、方向テストの検査、次が A ですね。これがアダクター、内転筋ですね。内転筋と関係ある。これは膀胱系。それで、キドニー。最後にそのパラロルトのルトのところだけキドニーゲートって言ったの、K1 って言って腎臓のポイントなんですよね。で、一応これが方向テストの概要です。これでですね、ちょっとそれでですね、次に TBM の副腎検査っていうのがあるんですけど、実はその TBM の副腎検査は、ですね、おへその上と下、そこの2本指でこう置いたときはアドレナリンですね。それで、ですね、2本指のおへその横のサイド、両サイドに2.5インチ、右に1本、左に1本置いたときに、インディケーター筋が抜けたらコルチゾン。これが TBM の副腎検査です。で、次にですね、これ皆さん知ってるんですけど、B&E ポイント、気血集血のポイントですね。で、あと5オーバー。で、感情の、さっきもやりましたけど、感情の神経検管反射点。これ、おでこのところに手を当てて、もしおかしかったら、これ、反応するということですね。それで、次にこれちょっと大事なんですけど、ジャゲュラーコンプレッションってで、形状脈の圧迫っていうのを使うんですよね。で、これは何してるかっていうと、形状脈を一時的に圧迫することによってですね、脳内のですね、静脈の圧を上昇させて、脳脊髄液の圧力の変化を起こすんですね。ちょっとクラニアルに近い感じのことをやってるってことですね。それプラス、リンパとその脳内のですね、つなぎ目をですね、こう循環させて、脳内に溜まったですね、老廃物を洗い流すという効果もあります。で、次がディープテンド、これすごく重要で、自分も毎日使ってるんですけど、ディープテンドンリフレックス、皆さん一番、深部筋反射ですね。これを一番皆さんが使うのは、ただの筋反射ですね。その筋反射して、例えばそのマッスルスピンドルセルからドルサルガングリオンで、脊髄に来て、またそのまま筋反射するんですけど、もう一つの使い方がありまして、これが今回ドクター・リーが使われているやり方なんですけど、大脳小脳の経路ですね、これを脳に情報、筋反射を使って脳に情報を送って、体全体に調整を行うんですね。そういうやり方を使っています。それで、こういう感じですね。一つ目が先ほどの腱反射、普通の腱反射ですね。脊髄に入って、また戻ってくると。で、もう一個は脳まで行って、で、また戻ってくると。こういうやり方ですね。この二つを使ってます。で、最後、あとは、皆さん知ってると思うんですけど、子宮リフトですね。リフトテクニック。下垂ですね。内臓下垂とか、子宮の下垂の時に、手を置いて、これを持ち上げていくテクニックですね。で、あと次。で、これもう一個、これ皆さん多分一番知らないと思うのが、TBM のですね、動脈の循環と静脈の循環ってありまして、そのポイントが、ここにあるんですけど、ちょうど、これですね、胸の中に4つ、上から下にバって接続するときは、あの、動脈ですね。で、下から上に一本一本、1、2、3、4って指を置いて、インディケーター筋が弱くなったときは静脈と。そういうことになってます。で、一応じゃあこれで、えっと、一応これが説明で、これからでこういうことをちょっと今出てくるんで、
get into the visceral problem. And also, visceral problem is affected by autonomic nervous system. Okay, please explain this into Japanese, Dr. Arai.
パロアルトってさっきのゲートのテストを使ってですね、自律神経の方にアプローチするという治療なんですけど、Can I play? Yeah.
Okay. And the autonomic nervous system. Autonomic nervous system is controlled by the brain.
で、自律神経は脳でコントロールされてます。Yes. Yeah.
We call central control of autonomic nervous system.
中央
Central control of autonomic nervous system.
あの、自律神経のそのセンターのコントロールによって行われていると。まあ、脳の中間、センターコン
I,
トロールですね。はい。はい。いや、yes.
I would like to recommend you Japanese doctors. Uh, Dr. Oba can provide several sessions, 4 or 5 sessions regarding basic neurological approach that include neuroanatomy, neurophysiology, and the autonomic nervous system, and also central control of autonomic nervous system. It is very important for you and Korea too, Korean doctors. Then we would like to interconnection, visceral, autonomic nervous system, and the brain, emotional stress. That yeah, if we would like to find out the basic underlying cause, we need basic understanding of functional neurology. So I think Dr. Oba can help your Japanese doctors to understand it. Please
で、大場先
try.
生にですね、ぜひ、機能神経学ですね、それこそ、神経学のその仕組みから、その解剖学からですね、5セッションぐらいで教わったらいいということを皆さんにお勧めしています。っていうのは、本当に、脳のコントロールですね、自律神経のコントロールとか、そういうものがすごく、治療に重要になってくるからですということです。
Yes, okay. Palo Alto is a portal of entry to get into the functional neurology, functional autonomic nervous system, visceral problem, or a central control of autonomic nervous system. This is not, I'm not expert. I'm not expert at this kind of approach. Okay, let me explain a little bit about it. Uh, just before Friday, on Friday, just before annual meeting of ICAK in Korea, Dr. Chang, he's a chairman of ICAK Korea. He asked me to help him uh, to provide a kind of lecture in his hospital. So I went from there. I went there on Friday as an assistant instructor to help Dr. Chen. And he he treated me. I think Dr. Arai remember me. He treated me a visceral problem by using Palo Alto, and then after treatment, and he should take care of his patient. So I would like to explain this Palo Alto to Japanese doctors. That's why I use this Palo Alto to approach to get. This is not my expert, but I will explain it in detail. Okay, Dr. Arai, please
はい。
explain this.
パワーアウトはですね、内臓とかその脳の機能にすごく大事なんですけど、実はこの分野のエキスパートはドクター・チンって言って、ICK コリアの、プレジデントのですね、神経外科医の先生なんですけど、その神経外科医の先生の病院で、実は日本人向けの、セミナーもやっていただいたんですけど、実はセミナーの直前でですね、ちょっとドクター・チェンが、 ちょっと患者さんで取り込んでしまいまして、急遽ですね、ドクター・リーがですね、それを代わりにやることになったんです。それで、本当は自分のエキスパートではないんだけどっていうことを今おっしゃってます。ただ、それでも全部、ドクター・リーが何でも分かってますので、韓国のセミナーでこのデモをやっていただきました。OK。
Hold, hold. Hold. Straight. I think you have, it is energy, it is energy level. I would like to check energy level and should go up this way, but this way, that means decrease the level of energy. What is your problem? Let me tell you, Palo Alto first. No. Right. In this case, we cannot go up to right or left, probably because this is stop here. So heart problem, heart coronary circulation. You should check coronary circulation first. How old are you?
Almost 50 years old on this
50,
November.
50 years old, very young people. 68.
You look young.
Looks young. Yeah. Okay. Heart. Liver. Liver problem. And TBM. TBM, Dr. Frank. You know Dr. Frank?
Yeah.
Yeah. And here. Okay. Oh. Okay. Oh. Yeah. It's adrenal function. Everything's. Okay. Then let's move posterior muscle. And I will lift up, right? Don't let me lift up. Don't let me lift up. And hold. Okay, the other one. Hold. Oh. Palo alto. Posterior muscle is posterior muscle, decreased posterior muscle, weakness on posterior muscle. That means SP, and yeah, and anterior muscle. 비장을 뭐라? 비장. Yeah. Oh. 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 That's liver. Okay. Please touch here. And hold. Increase. Strong, right? Yes, strong. Take off your hand. Hold. Very weak, right? So, what about yeah, it's a lymphatic point. And 14 to 15 to 4 space. And what about stomach? Hold. Lateral muscle. Hold. Hold. 7 poster space. 6 into poster space, right? Yeah. Oh. Oh. Yeah. And better, right? 6 into poster space. You feel pain? Tender?
Tender.
Oh, yeah. Yeah. Palo, P-A-L-O, 그다음 O. It's oblique muscle. I just check this muscle. O. Okay. Would you lift your right shoulder? And O. Okay. Would you touch here, just below the liver ganglion point, or you can lift your GB just slightly, and hit your shoulder. Oh, better, right? Better. Yeah, GB. Wow, everything. I think this is my first time to see all of these kind of problems.
Sorry.
It's okay. I think there is something. What is the I just thinking about what is your main primary cause of all of these kind of problems? I didn't ask about your history.
Yeah. When I was a teenager, 70 years old,
Uh-huh.
I got the operation of appendix.
Uh-huh.
After that, I got the
Appendectomy.
yeah
Yeah.
appendix inflammation.
Uh-huh.
That's taking out the organ. It's a big scar tissue here.
Why it is big? Because the post-operative infection or
In midnight,
uh-huh.
I had a strong pain,
Uh-huh.
and I went to the hospital, and there are no special doctor for the abdominal.
Perforation.
Yeah.
Perforated appendicitis, right? Yeah. And then peritonitis.
Yeah.
Okay.
After that, I got injury of meniscus right side.
Uh-huh.
It's caused by surfing, twisting the knee joint, and I cannot move enough hip joint and the legs after this injury. I trained a lot around the legs and the buttock. This problem is gone, but I hit it
Mainly
something.
on the right side.
I mean on the right side.
Yeah. Okay.
And I use right leg a lot because I'm doing the surfing more than 30 years old. 30 years. So actually, was use the boarding, surfing. It's a very I suffered very stress, mechanical stress on the body.
Okay. Yeah. Okay. Then the last one is okay. Yeah. Sure. Thank you. I'll pull. Adduction. Yeah. Probably he has right side of problem related to the functional part of your brain. Then brain controls everything reciprocally, and this area of brain, you can look at it. Okay. Hold, and I will push this way. Hold. Okay. On the other side, hold. It's okay. And the last one is iliopsoas muscle and the pectoralis major sternum. Hold. Come here. Would you come here? You can come here. Now we'll touch here. Okay. That's K1, right? No. Relax your hand. Relax, okay? And this tension and hold. Better, right?
There.
Okay. What about?
Oh,
Very painful, right?
yeah.
It's a treatment point. Everybody has this kind of weakness. You should hear K1 pressure. Very painful. It should not be painful, right? That's why you have all
Really?
right side of this.
Which point?
Which point is K1.
足の裏ですね。
K1
足裏にある
is here K27, right?
Ah,
That's a meridian point of kidney.
kidney.
Kidney, the first one, K1.
That point.
Yeah. The other side. Yeah. Hold. One more. Yeah. I'm very obsessive. I'm different from Daru. Dr. Zhang. Dr. Zhang is very smart. I'm not very talented. So I just check. I'm very obsessive. It's different, right? Yeah, this one and this one different because meridian, kidney meridian here you have big trouble here.
Oh.
And this year we are upright position animal, right? So we need this one leg, foot, leg, gait is very important. So this make you trouble, or whole area of kind of problem. Okay, this one side of a lesion. There are three, as I know in my experience. One side lesion, whole area, injury, pain, problem. There are three things. One is the leg problem. The other one is brain. And third, TMJ, in my experience. So you don't have any TMJ problem.
I don't know.
No, okay, that's okay. We
あ、本当にティースプーン。親知らずは英語でなんて言う
Oh, wisdom teeth.
Wisdom teeth.
ここ両方大きいの取ってる。
Oh, he had a wisdom teeth removal.
wisdom teeth
Removal.
remove.
Uh-huh.
I don't think that's not. Okay, let's cure. Let's treat this kind of Palo Alto. Then, if there is, you can see the change of heart problem. Then you can check brain function, and if there is brain decreased brain function, you can if you can improve the function or not. Okay. P8, Panel A. Okay. Spleen. Let's say lifting here, just the lifting. And hold P. Hold. And one more. Okay. Let's check the other one. Hold. 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 It's better. Okay, I think you better hold this way. Okay. And hold. And relax. It's my name. And jugular compression. Not this compression, just soft touch. Soft touch. You can see the increased intracranial pressure. You feel. You feel increased pressure of your cranium. Just a touch here.
Just a touch.
Soft touch. Increased pressure, right? And hold your breath. Just knee jerk. And relax. Look. Did you push your thing this way? Okay. Lifting. Every visceral, we are standing here, right? So not just upside down, standing. The problem is ptosis. Ptosis of stomach, ptosis, everything's ptosis.
内臓か。
Hold. Stay cold. Okay. And, yeah. Hold. Lifting. Hold. Lifting. Better, right? Okay. And liver. Think. Better. Hold. This one would be better, right? Liver, hold your liver, and yeah. Yeah, increase your pressure, hold, relax. Okay, take off, take off. Let's check. Anterior, hold. You think it's better?
Yeah.
Yeah. Hold. Still you have problem here. Still liver meridian. Okay. What about here? Pain?
Yeah.
Okay.
Oh.
Pain, right? Let's lifting. Hold. Pain. Pain right there. Pain. Relax. Relax your leg. Okay. One more. Hold. The other one. Hold. Okay. I think it's better. What about it? Liver. Hold. Do you think it's better?
It's better.
Liver. And stomach. Not sure. Hold. I think the liver, I don't know the doctor's name, in Australia, very famous visceral.
ああ、ドクターポルテリ
Dr.
ポルテリ
Porte, yeah, he lectured here 3 days, 2 times I think in Korea. I took his course, not whole course. It's very impressive. So he described stomach. Hold. This way. This way, right? This way. Which one? This way? Because it's very noxious. Very noxious stimuli makes muscle weak. Or this one? Yeah, okay. This one? Yeah. This is the main problem, I think. Okay. Dr. Potelli said, cough, cough, cough. This is one of the Dr. Patel's method. Let me check again. Oh. Better, right? Yeah, every road goes home. Rome. Every road goes home. But goes Rome, go to Rome. Yeah. But, and I think you better do this lifting stomach. Touch. And increase the pressure, cup. I think this is better. Take off. Stomach. Oh, you have emotional problem. Yeah. I think that emotional problem. Yes. And let's go GB. GB. That's lifting your whole area. GB. Lift your left shoulder. Yeah. Hold. Oh no. Relax. That's not work. Yeah. Let's hold. Better, right? I think lifting just this area will be better. And hold. And relax. Take off. Lifting your right shoulder. Hold. Left shoulder. Hold. Relax. I think there must be something wrong. Other. Pain, right? Yeah. Yeah. Meridian point. GB is related to. Yeah. Touch here. Improve. Tip tender reflex means tip tender reflex is a kind of monosynaptic reflex. It goes this way. Those are root ganglion, the spinal cord, and the ventral horn cell, and this quadriceps muscle extend your leg. That's is a monosynaptic reflex. But that's not just the only reflex, but this pathway goes to spinocerebellar pathway, anterolateral and spinocerebellar, ventral spinocerebellar pathway to cerebellum goes up to dentate, thalamus, cortex going down. Everything's going wrong. So many pathways. So that's why we set neural pathways, for instance. no lifting. Hold. It's better right there. Yeah. And bladder was okay. Hold. Yeah. Yeah. There must be something wrong, bladder or prostate or something function. So, I don't know exactly.
Is it?
Right? Is there something wrong? A doctor. Yeah. I will push this way. Hold. Oh. Bladder. Where's bladder? Any point. Bladder. Okay. Let's touch here. Hold. It's there, right? Okay. Let's try to lift this way. Okay. Lifting. I think this is a kind of autonomic dysfunction, central control of autonomic dysfunction. Autonomic system is controlled. Autonomic is not just autonomic. Autonomic is controlled by pontomedullary reticular formation. Pontomedullary reticular formation is monosynaptically synaptic from cerebral cortex or limbic system. So if you have any kind of emotional distress, consciously or unconsciously, you don't have any experience. You don't know. Okay. Yeah, 15. Okay. One. Lifting. Cup. Or it's very effective. I don't remember exactly. Dr. Kuda demonstrate. Dr. Rai, you know, I don't remember. I don't usually use this kind of method. I don't remember the respiration. Lifting up, expression lift up, or inspiration lift up, I don't know.
Expression, yeah,
Expression.
uterine lift, yeah.
Yeah. This, and I push here, breathe in, out. Breathe in, out. Now, lifting up. Breathe in, out, lifting your leg. Okay, let's try again. Yeah. Hold. Hold. Or descent. It's better, right?
It's better.
What about your point?
It's better.
Better? Really?
No pain.
Okay. And the other one. 이쪽이 이제 참. This is kidney. Kidneys. Can you do it? Would you kidneys around here? Would you lift this way?
Yeah.
Push upward. and hold your jugular vein and take off this. And off. Just relax. Never, but you still have a problem. I think you need a good exercise. You know any kind of good exercise? And if you have a golf ball, golf ball exercise. Dr. Leaf used to use ball exercise. After ball exercise, bend forward, this one, this way, and after ball exercise. So that was very impressive in 20 years ago. But in his course. And let's try again. Lifting. Yeah. Lifting and jugular vein here. Relax. Lifting. Or probably the other side. Lifting. There are two kidneys. Take off your hand. Lifting. Yeah. Better?
Yeah.
Better?
Little pain, but better.
Better? The jugular vein. Relax your leg. Okay. Take off your hand. Better, right? Okay. Relax. Look straight or close, or you can close your eyes. Hold. Hold. This would be better. Hold. Hold. Okay. My finding has been better. Just 1, 2, 3, 4, and from top to bottom. Okay. Hold, and we can check here. Left side of the brain dysfunction due to right side of the lesion, or which one is first? We don't know. The other side. Oh, it's okay, right? The left side. Wait, you see? You feel right? Cerebellum. Don't move. Hold. Wait. Right side of cerebellar lesion, because decreased afferentation on the right side to the cerebellum, that means decreased function on the right side of the cerebellar lesion function, and left side of cerebral cortex, and thalamocortical feedback loop, and also I think if there is magnetic, and north pole, then push here, touch here. Oh, yeah, it's a midbrain. It's a midbrain function. Oh, okay. It's arterial circulation. Or if there is venous circulation, we touch here. Okay. Down to up. That's venous circulation. Okay, arterial circulation up here. Oh, and if it gets weak, there's something wrong here. Arterial circulation on this side. Okay, or this area. That means this area decreased circulation means decreased function. Here, decreased function. So in this case, left side of the brain, please. That's why you have right side of decreased function or easy to get injury. Okay. Yeah. So. Okay, would you sit up, please? Okay. And check rib biomechanic. Would you sit up, please? Stand up, please. If there is some kind of limitation of rib on the right side, I can adjust the right side of rib. Here, look up, and the shoulder, the shoulder problem. Okay. Okay. And would you lie on your back, please? Curious. Please. I don't know how. Oh, yeah. Oh, yeah, here, right? I used to adjust coupled manipulation by Dr. Carrot. You can take a picture, a video here, then I will adjust here. So if you can check, you can take a picture here, right there. So I think this is 2. I think this is 3. That's the problem. Yeah, lifting. Y-axis lifting and adjust here. And laminar pedicle here. So here. Manipulation. Okay. Just relax. And the left side. I work here. Or elbow. Okay. Oh. 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 Okay. It's gone. And would you put this way? Top to bottom. Okay. Oh. Just hold straight your elbow. Hold. Hold. Better, right?
A little bit.
Hold. Hold. All right. if you are doing a lot of work in computer, then you save it. You should save it. So I treat him. What is your name? Sato. I treat Sato Sensei. Then I should save my treatment in his body. Right? So, just sorry. Okay, hold. This. Okay. Hold. Hold. Okay. This is TBM, Dr. Frank method. This one, like this. This is epistonal notch. This. Yeah, epistonal notch. You know epistonal notch? This is a sternum, right? Manubrium sternum here. This is epistonal notch. And touch. You don't have to touch. He used this like this, but I'm very obsessed. I try to correct perfectly this way, and then hold. That means weak, right? That means no more treatment today. If there is something wrong, stop here and do it tomorrow or next day, next time. So hold. Weak, right? So this way, this one. 3 phases of respiration for parking, saving. 3 phases of respiration. Breathe in, breathe out, breathe in, breathe out, and hold. Breathe in, breathe out, and hold. 3 phases of respiration. And T8 tapping. T8 tapping. Yeah. Breathe in, breathe out, hold. Yeah. Okay, you can breathe. Hold. Hold. Now it's safe. Your symptoms will be improved. Let me check your emotional point again. Structure affect the mental affect the structure, mental structure, chemical affect the structure, everything, right? So we don't know what's going to happen. I think you better do it's homework. Homework. Please think about from your memory for 3 years old, and from now you have any kind of emotional stress at that time. Now, not now. That time. Then one sentence. The emotional stress is framed time, space, person, event. Then the four is framed. Time, space, person, event. There's 4 things, 4 components is framed. So you don't have a lot of history. You don't have one sentence. If you give me tomorrow or the day after tomorrow, then I can check. Good. I'm not sure I can do this in English. Okay, close your eyes. Okay, let's go. Let's close your eyes. Think. Let's go up high in the sky, like birds. Okay. Let's go up high, very high, and go back to your age 28, and go down 100 meter, 15 meters away from high in the sky. You are high in the sky, and there's your 28 years, and you can get some kind of emotional stress. If you can see that kind of event, what is learning? What is your learning from it? What do you think is your learning from that kind of event right now? When you see this kind of, what is probably your learning from that kind of event? So, forgiveness, or put there everything's you like, your painting or your song, your favorite, everything's put there, and then go up in the sky, and go to your childhood, the happiest area, and then go down when you're a child. Then you feel emotion, good emotion, and then goes up in the sky, very high, and go to the future, and your knee, foot, wrist, and everything's in your visceral or your emotion improve. Your business, very good, and in the future, going down, and there high in the sky, and look at your recent your activities, and then going down here in Korea. Okay. This is kind of timeline therapy, Dr. Ted James. If you look at timeline therapy in internet, it is very easy to learn Dr. Ted James. Or if you can do the EFT, emotional freedom technique, or TFT, pulse field therapy. And open your eyes. Hold. Hold. It's better, right?
It's
Oh yeah. Close your eyes.